now to speak a little bit more in detail of the architectural politic and its impact on the subject that interests us today. I will invite Mr. André Bourassa to come and speak. So Mr. Bourassa was president of the Order of Architects of Quebec for 4 consecutive mandates from 2005 to 2013. He's an architect and founder of Bourassa and Associates, and he's a leader in the energetic domain and innovative strategies. To discuss his work with us on air quality and materials and subjects that touch us with their architecture, I invite Mr. André Bourassa. Hello. Hello. Thank you, Viviane. Thank you for this presentation. I will go ad lib without any text, any presentation, one sentence after the next to speak with you about experiences that I have had in the domain of interior air quality, particularly and thanks to the program of the ASEQ-EHAQ, I've given training over 15 years on interior air quality. We've formed investigators for air quality, and I'm not 22, it's visible, yet it was very rich in teachings and returns on experiences throughout these years at the ASEQ-EHAQ, but also through all of these years as a president in the order, receiving confidences and comments from my colleague architects in terms of buildings. I have a very short time to address you, and that's okay. It forces us to be quite synthetic, but no later than yesterday, I was in a grouping, a real estate grouping, which is very damaged by water. And it's not an old building, but it's major. It's several thousand, tens of millions of dollars in value. And on the quality of interior air, you are aware of the chemical contaminants and biological contaminants, and also of our sensitivities that are differing. We're in a domain where in the health domain and building domain, and in one case for the people in as architects and engineers and others in the health domain, we have different objectives. They're very differing. My doctor, or no matter how he takes care of me on my very last day, I'll be 6 feet under. It cannot be any other way. In terms of buildings, we expect that the roof doesn't leak, that there's no water flooding and this kind of thing. But we must add beyond the materials with low emissions, because I remind you of the time of the ASEQ-EHAQ, when it was time to produce a document which would be named Simple Materials Guide. It had to be called a guide for delicate materials for sensitive people. The industry was uncomfortable about this document in the following sense, that we who produce materials, are we creating unhealthy materials? This is where our elected members were being called. And we have to be very careful of this. The architectural politics, I'll discuss it a little bit. Within this, we have principles which are extremely positive, extremely interesting to have not only an architecture of quality, but buildings that are sustainable. What this offers us, or what is the purpose of giving an abundance of style if at the end of the day, people are sick in their homes for reasons of chemical or biological contamination? I've had the opportunity to express this in a parliamentary commission several years ago to the elected members of the National Assembly to say it's more spectacular a beam that falls, as it happened at that time. This is more spectacular, but the contaminants in the interior air kill slowly. It's less spectacular, but we must speak about it and we must be vigilant about this. What does this mean? It means that budgets that are created to build new buildings or to renovate existing buildings, this means that the budgets must be used properly, not only in habitats, but also in school and industrial buildings where we spend a lot of time. Brief parentheses concerning the limits. Do we establish limits of contamination for everybody? I can't do better than to share with you, of course. I'm not a specialist or a hygienist or a biologist. I'm simply an architect, but who has worked through this a lot. And now I'll share the opinion of a chemist who is the instigator of the air quality program at ACHL, to say that one level, we can establish it for a work environment, for a person in good health. Can we establish the limit for small children who are crawling around on the floor, or for people, elderly people who are weaker? The levels, the limits won't mean the same thing according to the clientele that we're addressing. To have had to investigate several buildings in terms of air quality, I can tell you that people found themselves very sensitive towards certain materials or certain products, and other people, it's towards other products that they react. There's really not a universal rule. We would like to have one recipe for everybody. Unfortunately, I think that human nature being as it is, which is infinitely diversified, thanks to its place of birth, its experiences, and so on. And this I share with you not only from my own experiences, but from those of Monsieur Prudhomme, who with me has given multiple trainings as in terms of interior air quality, who is a doctor in Quebec and who is much help, much assistance for health aspects that we worked on. This also meant that in hindsight, after these 15 years, excuse me for the interruption from my telephone, after these numerous days at the ACHL, this meant that people called me in my architecture offices for all sorts of situations. But when somebody calls, they say, my partner is a doctor, but he doesn't believe me. And I'm the architect. I should diagnose differently the person who I think we play quite prudently to avoid such traps. I return to the architectural politic to at least speak of the stages and conditions of quality conditions to have a good project. And in this, it's easy to find on internet the terms which I'm sharing with you today, meaning the conditions of success for an architectural project, meaning a good definition of needs. This means, for instance, if in my clientele, I'm working with a person who is more sensitive to certain products, this is part of a specific definition of needs, but it's very, very rare that we will take this care, but it's not impossible. It can be done. Next, a deadline, a sufficiently foreseen deadline. We have to ensure sufficient time to put a project into work. Sometimes the materials are special, parentheses on materials, to feel the materials, to have the client experience the materials. If these people have declared a particular sensitivity, it's very useful to put them in contact with the materials that you plan to use. So we are in a time frame which is sufficient to work on these aspects. We also have a budget in phase with our goals. We have a very well-known singer in Quebec who had a theater built for her in Las Vegas. She had a great budget, but she wanted even more. So there were adjustments made. So in lodging and housing, there's no price predetermined per square feet. It varies enormously from one construction to another, as particularly in the housing domain. Another important aspect is an efficient process to request prices, to choose your business team. It's very important. And finally, a return on experiences. a revision, post-mortem. You are very well aware when there are litigations in construction, from the moment, and this is a good thing, as long as we have a good protection with insurance, the rulings are made behind closed doors without admission of responsibility. This can be understood, yet at the same time, this means that we don't take advantage, unfortunately, of the past experiences to improve ourselves for the future. So the post-mortem review is very, very important. Do I need to remind you that even if we have chosen materials with the weakest emissions possible, there will always be the possibility that you find chemical emissions when you go to the grocery store, whether it be personal hygiene products, washing detergents, cleaning products. And this is insidious. It's very insidious because we associate these products to what is clean, to what is sanitary. The clean car, that wonderful smell of a new car, yet it's not without consequences. And so a lot of efforts are being made elsewhere in the world around this. The architecture policies, we could discuss this again on the human aspects, and the air quality is part of it. But the air quality is not the only need of the human being. The human being needs light. The human being needs to socialize. We need quality food. So when somebody says, I feel really bad in my home and I feel really good elsewhere, it's an indicator that we can take as a very interesting departure point. But of course, we can't put everything just only in the basket of air quality. This is very important to me, and this is what we have noticed throughout many, many cases that I've had the opportunity to work on, and also in all of the trainings that I have offered. And so I would end on this. I see that the time has already passed. I think I had about 10 minutes, correct, Valerie? It's going very well, Mr. Bourassa. In fact, you can conclude. We're in good time. Wonderful. So I invite you really to go and see on the internet, Politique d'architecture, Gouvernement du Québec, even if it's part of a global strategy, even if it's not a document that is legal, it's very transversal, diagonal. We said it's like the feminine condition. It doesn't touch only one ministry. It touches several ministries, whether it be the health network, education. It's worthwhile. And it's a cultural question. Also, we discussed heritage. We have a case which is very dramatic, which has just occurred in Old Montreal. We don't want to have others, but once again, it touches several ministries, several ministers. All these people must work together. I don't like hearing myself say a sentence begins with, we must, because it doesn't include anybody at the end of the day. But I wish for us to put our shoulders to the wheel, and we have yet to build many new homes. If you haven't heard the expression housing crisis, we're not on the same planet. We have to build housing, possibly more modest, possibly reduce, reevaluate needs to have more sustainability. We have the privilege of initiating this, and I will do it through other courts or tribunals where I've been confirmed. And this is really to my pleasure, whether it's for a nonprofit organization to create new housing or through the guarantee plan of the AGCR. I hope we'll have the opportunity to share our experiences. And I end with one experience, which was that of the CMHC, where about 20 years ago, they created a building for people who are hypersensitive. And I remember that the businessman was teasing the group, saying, you're putting up too much lace, too many curves, too much design, and you're forgetting the sustainability of the building. 10 years later, when we revised the experiences of that building, the inhabitants said they could breathe really well, but the appearance was really lousy. It was depressing. So I leave us, I hope, on a note that is not depressing, to go towards better and what is most environmental, because what is most sustainable for air quality is finally much more profitable for the environment also. Thank you very much and enjoy the continuation of your seminar.